IMC is actually a number of working parts. It stems from data analytics on the corporate side to a self-help mobile application to physician and conservative care clinician training to quality assurance. What IMC is a solutions provider, a clinical solutions provider for musculoskeletal problems.
If you really want to get better at what you're doing, you have to be able to measure it. So that's the basis of the outcome strategy. It allows you to measure your performance in regards to how well you're treating your patients.
So when a patient walks into the door, they're set up on a kiosk by our administrative staff, and they're taken through near a 5 to 10 minute assessment process that asks them questions about their medical history, specific questions about their clinical behavior, and then standardized assessment questions that are going to give us their benchmark levels of pain, function, and levels of daily activities. We're looking at their level of improvement throughout the whole care process, so from beginning to end. So we use that information to look at on an aggregate level how good an individual clinician is doing, to see if we need to provide extra education for that clinician, how good a specific clinic is doing, to see if there's a clinical problem that's persistent throughout the whole clinic, or how good a clinical program is doing. For example, for a certain self-insured employer client, or for a certain health system, how good the musculoskeletal care is from a clinical outcomes perspective. So we're analyzing all that data using our analytical software, and then reporting on that on a regular basis to the client.
If you're not looking at how you're doing as far as your outcomes with your patients, or if your patients are improving and you're never checking that, then you never know if you can improve or if you need to improve.
So data analytics, that's a broad term. It includes many things, but for us it means taking measures such as claims data and looking at patterns in that data and analyzing models, extracting models from the patterns that are in that data. So we take our clients' claims data, which are often 1 or 2 million records for a year for a larger client, or maybe if it's a smaller client, it's 2 or 3 years worth of data that aggregate up to, say, 1 or 2 million records. And then we take that data, the claims data, we process it, clean it up so that we can understand it, and then again we look for those patterns in the data. Those patterns allow us to build models and so set thresholds where we define an opportunity where our clinical methodologies can come into play and help reduce the cost associated with all the treatments.
My first love is to work with a patient and help them get better with whatever they may come in with. The second thing that I like to do is I like to be part of an organization that's helping other clinicians throughout the United States and surrounding areas become better educated on what we do and the process that we use, and help them become better clinicians.
IMC has a number of training programs. We train frontline clinicians, whether they are family practitioners, nurse practitioners, or physician's assistants, on how to triage musculoskeletal disorders in order to detect green flag or rapidly reversible musculoskeletal conditions. We train conservative care clinicians who have an MDT background. We train them towards a standard in order that they can assess and make treatment decisions that are consistent with the outcomes that IMC not only produces but also guarantees when we partner with our payer clients. We also train patients themselves to self-manage or self-care their condition, and we do this through in-house training as well as through a mobile application.
this sort of care is completely different. This is the basis of this type of care is on self-care. So it's mainly educating your patients on how they can get better themselves. And I thought this lended itself very well to a mobile app because it's not a hands-on approach. You can teach your patients what to do and empower your patients to get better. So having my technology background, I thought this would be a great way to be able to access many more patients than what I'm able to do in the building.
Patients have been given so many different interventions, so many different procedures for musculoskeletal health. So IMC really wanted to empower the patient and be able to let the patient take their musculoskeletal care into their own hands and be able to really educate themselves about the basics of musculoskeletal care and how to develop self-care plans based off of the education that they're learning.
Our version of musculoskeletal population health really centers around creating awareness and education and understanding for patients around what sort of musculoskeletal solutions are most effective for their condition, how they can identify more patient-centered approaches to managing musculoskeletal disorders, self-care strategies that are really at the core of our entire effort help accomplish that, and kind of shifting the locus of control away from providers and more towards patients.
You know, someone managing themselves numerous times throughout the day, utilizing the proper movements and proper positions, are better clinicians than, say, myself or any clinician out there treating them once a day.
If there are very specific movement-based strategies that can mitigate that pain, then the person best suited to deliver that treatment or that intervention is the patient.
Any clinician who works with us has to have an underlying training in mechanical diagnosis and therapy. They can either be credentialed in it or diplomaed in it, or we have had some people come work with us and they are in the process of taking the courses and they're almost ready to sit for the certification. We put them through an outcomes accountable clinician training, which has more rigor and covers some aspects that you don't typically get in your day-to-day musculoskeletal training. And then we do a grand rounds process weekly. If that patient self-reported outcome hasn't reached a certain level or a certain threshold, they are automatically picked to be brought up in grand rounds. When a person comes up in grand rounds, what we do is we problem solve.
Musculoskeletal conditions are becoming not only a significant expense to society, but they have become such a significant problem for the individuals and the organizations for whom they work. They become the #1 chronic condition in the world. So what inspires me the most is the opportunity to get as many patients to be able to self-resolve their condition as possible and to keep them out of the medical system.
By nature, I've always been somewhat disruptive. I like to influence and create change where I recognize there's a problem. And my passion is trying to find solutions towards disrupting the existing system of institutionalized success that we've got and driving in new innovation and creating value for those folks that are funding the healthcare system today. I guess in a nutshell, doing the greatest good for the greatest number is really what inspires me and kind of creates the drive and motivation I need each day to get up and come to work.